All medication reconciliations can be done from the orders page. Documented meds by history must be completed prior to admission reconciliation. Normally, pharmacy techs and/or nurses will complete the history. However, providers still have access to this feature. If the medication history has been documented as completed, the status bar will display a green check mark. If it has not, and you attempt to do admission reconciliation, you will get a warning box that you can't get past. Access to a patient's external medication history may be available. Previous prescriptions from participating retail pharmacies, insurance plans, or benefit managers can be viewed by clicking on the External Rx History button. Select Consent Granted in the Patient Consent window that opens. If the patient information is contained in the database, a list of medications will display. Some patients may not have information. Once the history is complete, the admission reconciliation can be done. Admission reconciliation should be done before admission orders are initiated. Click on the Reconciliation button and select Admission to open the reconciliation window. A line item for each medication in an active state on the medication list will be seen in the reconciliation screen. The scroll identifies history meds, the pill bottle identifies prescription meds, and any active inpatient med will be identified with a hospital icon. Any active inpatient orders will automatically default to be continued. The orange circle with a star will display at the left side of each unreconciled medication. The number of unreconciled items and missing details is identified at the bottom of the left of the screen. If the reconciliation is signed without addressing all medications, the system will show a partial reconciliation denoted by the circular arrows instead of a green check mark. If we reopen the reconciliation window, except for the inpatient orders, each other medication must be addressed. To continue a medication as an inpatient medication, select the button under the green arrow. To place a prescription or history med on hold, select the button under the red square for Do Not Continue. These will be addressed again upon discharge. As you address each med, any formulary medication will convert to inpatient meds, and the physician will only need to complete any missing details. If a medication is not in the hospital formulary or has a therapeutic substitution, windows will open to give the possible alternative selections. Select the desired alternatives by clicking once on the preferred options. Click OK and return to the reconciliation screen. Click on the listed medication in the right pane to open and define or modify the details. To complete the reconciliation, the provider must activate the orders by choosing Reconcile and Sign. The orders will become active immediately. For orders which should not be active until a later time, click Reconcile and Plan to return to the Orders window. This would be desired if the patient is not admitted to their nursing unit yet. This planned reconciliation can be initiated by a nurse during the admission process. A nurse does not have the ability to perform the reconciliation, but can initiate the reconciliation after it is planned. Transfer reconciliation should be used when changing levels of care for a patient. The transfer reconciliation process is similar to admission, except that it encompasses all active orders for a patient, not just medications. In the reconciliation drop-down, select Transfer. Again, for each medication you must select either to continue or to discontinue the orders when the patient transfers. Medications need to be addressed individually, but non-med orders can be addressed in groups by selecting the All box associated with each category, which will continue or discontinue all of that category. To save time, you can click the All option, then select the Other radio button to change specific individual orders. For both admission and transfer reconciliation, if you wish to alter a medication, select Do Not Continue, then add a new order through the reconciliation window with the desired details. When no unreconciled items are left, click Reconcile and Plan or Reconcile and Sign, as appropriate for the patient situation. If the Plan option is selected, a temporary icon displays in the status bar, which disappears when the reconciliation is signed. A completed transfer reconciliation does not have a status icon, such as admission and discharge. For discharge reconciliation, choose Discharge from the drop-down options. The process is similar to admission reconciliation, except the option to create a new prescription is available. As before, you can choose to continue the med at home, discontinue taking the med, even if previously a home med, or to create a new prescription on either a continuing med or a new med. For prescriptions and continued meds, if any required details are missing from the instructions, a blue circle icon will be visible. All the required details must be entered before reconciliation can be completed. For each medication that is on the right side, any additional information needing to be given to the patient as a part of the discharge paperwork can be entered in the note field at the end of the medication line item. IV medications will be dithered out in the discharge reconciliation window. If an IV med is needed for after discharge, add a new prescription by selecting the Add button inside the reconciliation screen. This process would also be followed if the patient was being discharged on a new med that had not been in the active inpatient orders and not a part of the previously documented history. If any of the medications will require a prescription, the prescription routing is a required field. Select the desired routing method in the Send To box in the upper right corner. The preferred pharmacy or a printer destination can be chosen from the drop-down options under Select Routing. Each patient area has a defined printer for prescription processing. The routing will default to the patient preferred pharmacy if it has been entered into the system. Controlled medications must be printed. When the reconciliation is complete and signed by the provider, the prescriptions will print or be electronically sent to the pharmacy. As a time saver, after addressing all new prescriptions, there are buttons which continue remaining home meds or do not continue remaining orders to allow you to completely address any unreconciled medications with a single click. The reconciliation process completes by clicking the Reconcile and Sign button.